Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Well Woman Wednesday. Come on in my office, girl. Let's talk some more today about birth control. Today's topic is the intrauterine device, or the IUD. Make sure you keep watching to get these important details. All right, girl gang, so let's talk about the IUD. I'm excited about today because the IUD is absolutely, hands down, my number one fave form of birth control. So the IUD is a T-shaped device that goes inside of the uterus. And this IUD is phenomenal in protecting against pregnancy, but there are a lot of other really great benefits to the IUD. So I'm gonna talk to you about these today. I mean, I'm not biased or anything, but it's definitely one of my favorites and it's what I have. The IUD is one of the number one selected forms of birth control by OBGYNs. So the IUD is the most common form of reversible birth control. So if you caught last week's video on the Nexplanon, which I'll link up here in the cards and down below in the description box in case you're not watching this on your app, I think that reversible birth controls that are long-acting are a fabulous form of birth control if you are not planning to become pregnant in the next year. About 23% of women worldwide are rocking an IUD, and in the United States, about 14% of women use IUDs or choose IUDs. And this is a big improvement. So between 2002 and 2014, more women in the United States started choosing the IUD. Only about 2% were using an IUD in 2002, but by 2014, a lot of women had caught on to the fact that the IUD is a great birth control. And I will say that there was certainly a scare around IUDs in the United States because back in the 60s and 70s, there were some IUDs on the market that had products in them that could lead to pelvic inflammatory disease. And these were the strings that were attached to the end of the IUD here. Some of those strings, some of the materials that they made those strings out of actually promoted infection. And once they figured out where these infections were coming from, they changed the material that the strings are made out of, and that kind of became a moot point or a non-factor in IUD use. And so once IUDs were manufactured safely, there was really no need to avoid those. So I think that the IUD got a bad rap in the United States, but now that that little issue has been fixed, the IUD is a great form of birth control and there's no need to avoid using an IUD if that's something that you're interested in. So the IUD has been around for like centuries, right? Since I don't know, some of the earliest recorded intrauterine devices or intrauterine items that have been placed to protect against pregnancy are recorded in like the 13 and 1400s, y'all. So the IUD is a tried and true method, even though we don't think about it that way in the US. In the United States, there are several IUDs that are out on the market. There are 4 different hormonal IUDs and 1 non-hormonal or copper IUD. So in terms of hormonal IUDs, the hormone that's actually coded on the IUD is levonorgestrel, or LNG for short. Hormonal IUDs include the Mirena IUD, which is probably one of the most popular, the Liletta IUD, which is kind of the competitor of the Mirena, and these have 52 milligrams of levonorgestrel coated on the surface of the IUD. The Kyleena IUD, which is kind of the younger sister of the Mirena, has 19.5 milligrams of levonorgestrel. And then the Skyla IUD, which is the baby sister, has 13.5 milligrams of levonorgestrel on its surface. Now, the non-hormonal IUD that we have available in the United States is the copper IUD, and that has 380 millimeters square. So that's like the surface area that the copper is coating on the IUD. So that copper needs to be at least 380 millimeters square or have an appropriate amount of surface area covering the IUD. And that's how it helps to prevent pregnancy. And so these are the ones that are available in the United States, but girl, all around the world, there are all kinds of IUDs that are available out there. So we know now that the hormonal IUDs really are probably the most effective in terms of preventing pregnancy, but the copper IUD is a pretty close second to preventing pregnancy. So we pretty much in the US only use the most effective IUDs that are out. So how does an IUD actually work to protect against pregnancy? So the IUD can cause thickening of the cervical mucus, and the cervix, remember, is like the door to where the sperm actually gets into the uterus and gets out into the fallopian tube. And so remember this video on conception and how the sperm actually has to get up through the cervix into the uterus and out into the fallopian tube to meet up with that egg. So the cervical mucus being thicker traps more of the sperm in the cervix and doesn't allow it to actually get up into the uterus and out into the tube to meet the egg. In addition, having the IUD inside of the uterus can cause changes in the lining of the uterus that makes it a hostile territory to sperm. So I like to think of those little arms as just like slapping the sperm around, keeping them from getting up to the egg. Most IUDs also cause thinning of the lining of the uterus so that if a pregnancy were to occur, it would not implant in the lining of the uterus. And so therefore, you cannot actually start a pregnancy. And in the case of the copper IUD, it can also be used for emergency birth control. So let's say you had a little slip up, unprotected sex, didn't really plan for that, and you're in need of emergency birth control, you can get a copper IUD placed, and that will work for emergency birth control, which is similar to, say, a plan B. So for women who prefer a non-hormonal option for emergency birth control, the copper IUD is a solution for that. People often ask me, what is your favorite form of birth control? And I will definitely say all day, every day, is the IUD, the hormonal IUD specifically. Now, I ain't trying to throw smoke at anybody, but the copper IUD is not my fave. It's a great choice if it is an option that will work better for you. Like say if you are just unable to tolerate hormones because of a medical condition or just because you really are opposed to putting hormones in your body, the copper IUD is certainly an option and a pretty good one, but it can increase the risk of heavier periods and more cramping. So I find that in the patients that I serve, my girl gang is not a big fan, and so it kind of over the years has made me not a big fan either, and that really has a lot to do with the efficacy rates too, like how effective it is versus the hormonal IUDs, and we'll get to that in a little bit. So let's talk about the pros and the cons. The pros and the cons of the hormonal IUDs specifically are things that I really like. So I feel like the hormonal IUDs have a long list of benefits that we can get from them, which is why I chose a hormonal IUD. So the hormonal IUDs are very effective against preventing pregnancy. So about 1 out of 100 women will get pregnant with a hormonal IUD in place. There have been several studies that show that hormonal IUDs can also prevent the spread of infection. So let's say you got gonorrhea or chlamydia, and we've been talking about STDs on this channel. So if you missed that playlist, I'll link it up here. But let's say you got gonorrhea or chlamydia. So let's say you got gonorrhea or chlamydia or another sexually transmitted infection. And if you missed the sexually transmitted infection playlist, it's linked up here for you. But I wanted to specifically focus on how these infections can go up through the reproductive tract. So you can actually get gonorrhea and chlamydia as a vaginal or a cervical infection, and then that infection can actually start traveling up into the uterus, out into the fallopian tubes, and even onto the ovaries. And that's a condition called pelvic inflammatory disease. Well, some studies have shown that the hormonal IUDs actually help prevent pelvic inflammatory disease. So if you were to contract gonorrhea or chlamydia after the first month that you've had a hormonal IUD inserted, it can actually help you prevent getting an infection that spreads up into the uterus, the fallopian tubes, and the ovaries. Another benefit of the hormonal IUD is that it's long-acting and it's reversible. And the majority of the IUDs that are out do not actually prevent ovulation. So that means that when you remove the IUD, it's much easier to go back to getting pregnant. And if you wanted to compare these head to head, the Mirena and Liletta are going to affect about half of women's ovulation. So about 50% of women will ovulate with these two IUDs. And remember, these are the higher dose IUDs. So these are the 52 milligrams of levonorgestrel. And then you also have the Kyleena and the Skyla. So with the Kyleena and Skyla, up to 97% of women are still going to have their regular ovulations. So that means that their hormonal cycle is usually pretty normal. And once those IUDs are removed, it's very easy for them to go back to getting pregnant, like within a month or two after removing the device, if they don't have any other underlying fertility issues. So IUDs do not cause fertility issues. I get a lot of questions about that. So no, that's a myth. Definitely do not. Mirena and Liletta IUDs that have the higher dose of levonorgestrel can be very helpful in treating heavy bleeding. So if you have heavy bleeding or period problems, which I also did a series on that I'll link up here, the Mirena or Liletta may be very helpful to decrease the amount of bleeding you're doing. And also if you have conditions like endometriosis, the Mirena or Liletta can be very helpful. And those are the higher dose hormonal IUDs. Another benefit that many people don't know about is the reduced cancer risk with the hormonal IUDs. And this was another reason why I'm a big fan of the hormonal IUDs. You can reduce your cervical cancer risk by up to 30% with a hormonal IUD. And over time, your uterine cancer risk decreases by 50%. And there are also some studies, some preliminary studies out showing that ovarian cancer risk is also decreased with hormonal IUD use. So I really am a big fan of hormonal IUDs because there are so many benefits. But what about the not so great things about hormonal IUDs? So one thing that can certainly happen with hormonal IUDs is there have been studies showing women with more frequent bacterial infections like bacterial vaginosis or yeast infections, because anything that you're putting in your reproductive system, like in your vagina, cervix, uterus, fallopian tube, can cause some changes in the bacterial neighborhood of the vagina. And so if that's something that you're noticing, my first response to that is a vaginal health probiotic, like a women's health probiotic, can be really helpful. And in addition, changes in your menstrual cycle can occur. So that could be a good or a bad thing. For the hormonal IUDs, usually your bleeding is going to be a lot less. So with the Mirena and Liletta IUDs, about 20% or 1 out of 5 women will not have a period at all. And for those who still have a period, they're usually going to have very light periods and very short periods. And so I would say that if you are someone who is okay with that, then this is a great birth control for you. If you really want to see a period every month, then the Mirena and Liletta IUDs, or the higher dose hormonal IUDs, may not be a good choice for you. So you may want to go for a lower dose hormonal IUD or for the copper IUD. With any form of hormonal birth control, breakthrough bleeding can occur. Breakthrough bleeding is basically bleeding in between the cycles, and you can see that with any form, whether it's pills, patches, rings, IUDs, Nexplanon. All of the hormonal birth controls can cause breakthrough bleeding. And usually the best treatment for this is a non-steroidal anti-inflammatory medication like Motrin or Aleve. You can certainly use that to decrease the amount of breakthrough bleeding and to also decrease the amount of blood loss with breakthrough bleeding. So to make that breakthrough bleeding a lot more bearable. So the other con of any IUD is poor insertion techniques. So an IUD should be done in your healthcare provider's office, preferably an OBGYN or a women's health nurse practitioner or a women's health PA. And the reason I say that is because this is a procedure that's taking place on your uterus. And, you know, no shade to any other healthcare offices or providers, but the uterus is what we do all day in an OBGYN practice. Some people are not as comfortable doing the IUD insertions as we would like for them to be. And so I think that also helps contribute to fear of IUDs, because when you don't insert it properly, that's how we get all these crazy horror stories that you reading in your girl's blog about, you know, the IUD was up somewhere in her abdomen, or it was, off, through the fallopian tube somewhere. And this usually has to do with improper insertion. So it's really important for you to make sure that your IUD is placed by someone who is very experienced and who can handle a complication if a complication occurs. The most frequent complication with IUDs is actually going through the muscle of the uterus with that particular insertion device or with the IUD. And if that happens, then we need to be able to remove that IUD and to place another one under ultrasound guidance so that we can see exactly where it's going and what's happening with it. And so I just say, if you're getting an IUD or any other sort of procedure on your uterus, probably want to hit up a uterine expert like a gynecologist. So when you go in to have an IUD placed, we're actually going to put in a speculum just like we would if you were getting a pap smear or a pelvic exam. And that exposes the cervix or the opening of the uterus to us. For me, my patients are going to have some pre-medications that they take, like Cytotec. Cytotec or misoprostol is a medicine that helps relax the opening to the cervix. And this makes it way easier to put the IUD in. And I know there's some literature out there that says it doesn't really make a difference. Well, I'm gonna tell you, as someone who has had multiple IUDs placed herself, that yeah girl, it does make a difference. And so I use it for my patients because it really increases their comfort level and makes it much easier for me to get the IUD in place easily. So the IUD is passed into the uterus inside an insertion device, and it looks like a little straw, and the IUD is tucked in there. And once you get it all the way up to the top of the uterus, you pull back a little bit and release those arms so that they can fold out and get into position, and then you push it back up to the top of the uterus and remove the insertion device. There are some little strings that actually hang from the IUD, and those should be hanging out of the cervix, and we usually trim those strings with scissors, and we don't trim anything else while we're in there. It's just the strings, so don't worry about the scissors being there. But it's going to leave the string about 2 to 3 centimeters out of the cervix, and this really serves for us to be able to retrieve the IUD when it's time to take it out. So we can actually just go in, take a tweezer, grab those strings and slide it back out. And for the hormonal IUDs, they're very soft and flexible and pliable, so it's easy to get them out. The Paragard IUDs or copper IUDs are also pretty easy to take out for the most part. If you should experience a complication during an IUD insertion, let's say you jumped off the table while the IUD was going in, or maybe the inserter was not, inserting the IUD properly, it's very important to see a gynecologist because you want to make sure that that IUD is in correct position, and if it's not, that it is either removed and replaced, or if there needs to be some additional procedure to get that done, that you're with someone who can help you out in that situation. Per the guidelines and the package insert for the IUDs, they should be checked by ultrasound either immediately after insertion or within 4 to 6 weeks after insertion. So your IUD should be checked with ultrasound before you're just allowed to, go back out into the wild. So let's switch to the copper IUD now. So the copper IUD is certainly a great option for women who want long-term reversible birth control. And like I said, it can increase risk of bleeding and cramping because the copper causes a reaction in the lining of the uterus that sometimes leads to heavier periods and more cramping. But if you are looking for the biggest bang for your buck, a copper IUD is certainly a great choice because for women who are under the age of 25, you can leave that IUD in for 10 years before switching it out. Between the ages of 25 to 35, you can leave that IUD in for 12 years. And if you're over the age of 35 and you choose a copper IUD, you can leave that thing in until menopause, girl. So you definitely get a lot of bang for your buck with the copper IUD. The cons of the copper IUD, other than heavier bleeding and more cramping though, are that it's not quite as effective as your hormonal IUD. So 5 out of 100 versus 1 out of 100 women will actually get pregnant with the copper IUD. And also some women are allergic to the copper metal in the IUD. So copper sometimes is actually rejected by the uterus uterus, and you can see expulsion rates that are almost twice that of the hormonal IUDs. So where you may have a 6% risk of expulsion with a hormonal IUD, you have a 10 to 12% expulsion rate with the copper IUD. So just some things to think about. If you are someone who cannot tolerate hormones because of a medical condition or because of, you just really don't want hormones, then the copper IUD is still a good choice if you are looking for long-acting reversible birth control. So let's talk a little bit about the hormonal IUD dosing. So I already laid out to you that the Mirena and the Liletta are the highest dose ones, and I really highly recommend those if you have trouble with heavy periods or endometriosis. However, if you're just in the market to help prevent pregnancy, the Kyleena 5-year IUD is a great choice. So your higher dose IUDs like the Liletta and Mirena are good now for 6 years. They've been FDA approved for 6 years. And the Kyleena, or the 19.5 milligram IUD, actually is approved for 5 years and does a good job with controlling cycles and preventing pregnancy. And then there's a 3-year IUD, the Skyla, and that's the 13.5 milligram IUD. So if you are not really planning to wait more than say 2 or 3 years to become pregnant, the Skyla might be a great option. If you have issues with hormones, when you've been on pills in the past or rings or patches, you've had a lot of mood disorder or a lot of nausea, a lot of headaches, this may be a good choice for you because this is the lowest possible dose. And remember that the hormonal IUDs are working inside the uterus. So there's very, very little hormone that's actually getting into your bloodstream and traveling, through your body. So I highly recommend for my moms that have history of mood disorders or postpartum depression, or for women who've had a lot of trouble in the past using hormonal birth controls, that using a Kyleena or a Skyla hormonal IUD may be a really great choice for you to not only protect against pregnancy, but to keep your hormonal balance pretty stable. The other thing I love about IUDs is that once you put them in, they're working. So there's no waiting period. Some hormonal birth controls require a 7 or 14-day waiting period before they're effective. But once the IUD is in there, girl, it's working, and it's going to keep working until you take it out. So like I said, there are lots of different IUDs all around the world, and there are certainly ones that are available in other countries that I didn't really discuss here, but if you're interested, do some research. There's some really cool looking IUDs like these I'm showing here. Now you can see why I love the IUD. I've had IUDs for like the past 12 years, and I really enjoy having very flexible, easy contraception and something that's very easy to take out and go back to being fertile. So the IUD may be a choice for you if you're looking for long-acting reversible birth control that's easy peasy breezy. So I love a good IUD. I hope now that you've learned more about it, that you love it too. Please put your comments, questions, stories down in the comments below, and I would love to engage with you about those. If you found this video helpful, how about a thumbs up for your girl? And make sure you subscribe so that you don't miss a single Well Woman Wednesday episode. I'll catch you next Wednesday, girl gang. Peace.